comprehensive introduction. I would like to share my screen now. Yeah. So, can you hear me? Yeah.
Yes, sir, we can
Okay.
hear you.
Okay. Thank you. Thank you, Mody University, for organizing this beautiful 6-day AICT training and learning academic sponsored faculty development program on AI and innovative engineering in healthcare from smart implants to wearable tech. Uh, So today's topic, I will cover about the development of nanomaterial-based electrochemical biosensing devices, specifically for two different cancers. First one is liver cancer, and another one will be lung cancer. So this is the representation of or what we are doing here in the field of biosensor at NAPR Ahmedabad. Our lab is mainly focusing on four different areas. First one is replacement of traditional electrode surfaces. That is generally we are using in when we are talking about the biosensors. Generally, ITO or gold electrode is generally used for the development of biosensing platform. So along with this one, we would like, or our lab is working in the field of thread-based biosensors and paper-based biosensors. Along with this one, another domain of our research group is material synthesis. There is something different from traditional nanomaterials, which are generally used for the development of biosensors. Generally, metal oxide, metal sulfide, or some carbonaceous metals like carbonaceous nanomaterials like carbon nanotube, reduced graphene oxide. This type of materials is used. Here, we are exploring some different nanomaterial like hydrogen substrate graphene. It is a derivative of carbonaceous nanomaterial. Graphene, graphene, and its oxide and reduced form. Along with the material synthesis, our lab is also working in the development of biosensor for various disease diagnosis, not only for cancer. We are also working in the area of swine flu diagnosis, cardiovascular disease diagnosis, and mental stress monitoring. So, in another domain, we are working in the area of wearable electronic devices with the help of paper-based electrode and thread-based electrode. So, content of this today's presentation will be first we will briefly discuss about the nanomaterials that about all faculty members are definitely aware about the nanomaterials. Biosensor, we will give brief idea about the biosensor. Here we will discuss two different projects. First, in the terms of liver cancer diagnosis, and second, in the terms of lung cancer diagnosis. In project one, we would like to discuss three different work. First one is hydrogen substrate graphene based biosensor for liver cancer, and then we would like to use or functionalize it with the help of some silent molecules, that is hydrogen, that is APTS molecules, and then we have intrinsically inbuilt some functional group just like CHO, COOH in the hydrogen substrate graphene. And this will be discussed under the work done 3 under project 1, hydrogen substrate graphene oxide modified SPE based biosensor for liver cancer diagnosis. In project 2, I will discuss here uh, nanomaterial based biosensor for lung cancer diagnosis. In the first work, I will discuss about the nano dot zirconium trisulfide. It is a type of chalcogenides, metal chalcogenides that is modified onto the that is electrophoretically deposited onto the indium tin oxide coated glass electrode. And in another work, we have replaced this ITO or traditional electrode with the help of thread-based biosensing platform. Along with this one, we would like also to show some electronic work we are doing in our lab that will be compatible for this developed biosensing platform. So this is the content of today's talk. So when we are talking about the nanomaterials, as we are aware, the dimension in between 0 to 100 nanometers, generally we have considered as a nanomaterials, and this dimension can help in improve several properties of the materials due to two different properties, that is larger surface to volume ratio, and another one is quantum confinement effect. So there is large application of the nanomaterials today, where we can go, we can see everywhere where nanomaterials is used, such like supercapacitor, water purification system, lithium ion battery, hydrogen storage, coating, drug delivery, several applications. Along with this one, there is the application in the field of biosensor also. So we will discuss here in the terms of today we will discuss in the terms of biosensor application. When we are talking about the biosensor, as we are aware that generally when we are going for analysis of our glucose in our biological food, that is in serum, then it is generally glucometer. A lot of glucometer is available in the market. So this is the first electrochemical biosensor that is marketized. That is marketized. So biosensor is generally analytical devices that converts biological response, that is concentration, having ability. This devices having ability to diagnose biological response, that means bioreceptors present in our body in the electrical signals, and electronic devices that is capable to integrate with this biosensing chip, having ability to read this electrical signal and convert into the digital form. So this is the basic concept about the biosensor. What is the biosensor is, and there is several components of the biosensor, such as samples, where we would like to diagnose a specific bioanalytes, bioreceptors, generally DNA, RNA, antibody, this type of biological molecules is used as a bioreceptor. Some biosensor is also developed that where bioreceptor is not used. So that will be the properties of a specific nanomaterial. Along with this one, a specific and important point is immobilization matrix. Here, several nanomaterials can be used as a immobilization matrix. It will depends on the biocompatibility or compatibility between bioreceptors and our electronic devices. Okay, so it will depends on the immobilization matrix. Several nanomaterials is generally used. Metal oxide, generally when we are moving for the marketized point of care devices, generally gold nanoelectrodes, gold nanoparticles is used, but cost is very high, due to which we are working, or several research lab is working in the field of diagnosis or use of several nanomaterials, or investigation of several nanomaterials that is more biocompatible with the bioreceptors and give good results, or that covers all biological parameters or biosensing parameters that can be used for the commercialized purpose. Okay, transducer, generally we are using electrochemical analyzer, but along with this one, several other transducer is also used. Signals, electric signals generated in the form of either cyclic voltammetry, differential pulse voltammetry, impedance spectrum. So several things, several electric signals can be generated. Several advantages of the biosensor in the terms of traditional techniques that are used for the point of care devices, used as a point of care, just like response time is very short, highly accurate, stable, and rapid. Reduced hospitalized cost or fee, required only a small sample volume, more than, and we do not need 10 microliter or more than 20 microliter of sample volume, either in the form of blood or saliva or urine. So sample volume is very less, tiny and biocompatible, and easy to use, durable, flexible, and nature. So there is several advantage of biosensor. Along with this one, we say various places we can use this biosensor, just like soil quality monitor, food quality monitor, pollution monitoring, toxic gas detection, pharmaceutical or drug analysis, and of course in disease diagnosis. So when we are talking about the component of the biosensor, so this is the bioreceptor, mainly biocompatible layer, that is, and another one is transducer, biocompatible layer, that is nanomaterials, and transducer, that means cyclic voltammetry, differential pulse voltammetry, several things we can use as a transducer. And this is the electronics part that are used for the that is used for the conversion of our obtained result in digital form or digital form. So first we will discuss about the project one, that is nanomaterial based biosensor for liver cancer diagnosis. Of course, we will discuss about the liver cancer diagnosis. So as we are aware that this is the third leading death causing cancer in 2020, and frequently it occurs in men. There are several symptoms occurs, but all occurs in later stage. It will be very difficult to symptoms appear in first or second stages. So symptoms is just like weight loss, appetite loss, nausea. This type of symptoms appears. Several detection techniques is available: ultrasonography, AF test, imaging, scanning, liver function test, and gold standard technique, that is biopsy. But cost is very high, more than about 10,000, 15,000. It is very painful. Actually, selection of tissue sample is very painful. So due to this limitation, uh, a specific point of care devices is needed that can able to detect liver cancer at the home places. So just we want to, just like glucometer, we want to develop a specific point of care devices that where we need only 10 or 20 microliter of blood sample, and through these biosensing devices we can analyze the concentration of a specific biomarker that are secreted in liver cancer. So when we are started this work, we have summarized, or we have did more than, or we have seen more than 140 biomarkers are secreted in biological fluid. So in this 140, it is very difficult to summarize here. So we have shortlisted here four or five, six or seven biomarkers, best six or seven biomarkers that can be used for the detection of liver cancer. So there is AFP, DCP, AFPU, several biomarkers is secreted. But when we are talking about its sensitivity, specificity, PPV value, NPV value, DA, so overall, anexin A2 biomarker shows very good properties in terms of all parameters: sensitivity, specificity, PPV, DPV, NPV, and DA. So due to this specific property, we have selected this specific biomarker for liver cancer diagnosis. And when we are seeing its concentration in normal subjects is varies in between 1.3 to 18 nanogram per ml. And after or beyond the secretion of 18 to 543 nanogram per ml, subject is suffering from the liver cancer. So on the basis of this one, this specific cutoff value 18 nanogram per ml, and properties of this specific biomarker is also on the basis of concentration. The stage is also increased: first stage, second stage, third stage. But after 543, patient will not survive. So from this specific biomarker, this type of diagnostic devices can help in detection of liver cancer, not in earlier stage. Also we can predict the what will the chances to occur of liver cancer in the normal subject. So due to with these properties, we have selected this specific biomarker, that is liver cancer, for liver cancer diagnosis. So this is the basic properties of the anexin A2 biomarker. 339 amino acid, actually below 110 amino acid, it is very difficult to use as an analyte. So this is in our range. Molecular weight is about 36 kilodalton. As we are aware that less than 10,000 kilodalton, it will be very difficult to analyze or to say it is a specific, it is a biomarker for liver cancer, and it is very difficult to detect or analyze. Another one is secreted in serum. So it is minimal invasive, overexpressed earlier stage, in zero stage or a stage it is over. It is expressed or this biomarker is secreted. Excuse me. Another one is upregulation of serum anexin A2 in AP negative cases, and it is independent of the age, sex, tumor size, and status. So these properties helps in anexin A2 biomarker. Anexin A2 biomarker that we can use this one for liver cancer biomarker. So first work we will discuss here is hydrogen substrate graphene based biosensor for liver cancer. So this is the materials that we have synthesized in our lab. So this is the, as per my knowledge, this is the first report towards the use of this specific materials, a specific hydrogen sulfide graphene in the field of biosensing devices, in the fabrication of biosensing devices. So this hydrogen sulfide graphene has sp2 and sp hybridized carbon atoms. Due to this specific sp2 and sp hybridization, it gives high surface. It gives tunable electron hoppings, a strong absorption ability for biomolecules, and uniform in plane cavities and healthier porous structure. These are the properties of this hydrogen substrate graphene. Along with this one, this is semiconductor in nature, having a specific band gap that is 1.98 electron volt, high carrier intrinsic carrier mobility that is 10 to 5 centimeters square per volt per second, and high conductivity that is 10 to 3 Siemens per meter. It is far better than reduced graphene in the reduced graphene oxide and graphene oxide in terms of conductivity and intrinsic carrier mobility. So due to these property, we have selected this specific nanomaterials, that is hydrogen substrate graphene for anexin A2 biomarkers. So this is the chemical process that we have used for the synthesis of this one. And we have deposited in, first we would like to see this material is work or no not work. So first we have used traditional electrode, that is ITO electrode, and we have seen its electrochemical properties. So we have optimized its electrophoretic deposition condition. We have optimized a good thin film onto the 550 volt for 90 seconds, and this type of films we have optimized in our lab. So along with this one, we have done some basic characterization, just like XRD, FTIR, and on the basis of this technique, we have successfully synthesized hydrogen sulfide graphene. So this is the morphological view that we have seen under the scanning electron microscopy, and this is the what we have obtained through the transmission electron microscopy. So when we have seen a scanning electron microscopy, then we have seen some uniform layer is open, but when we move to the lower magnification fabric, there is some roughness is there. When we are talking about the transmission electron microscope, we have seen few layers of the hydrogen substrate graphene is synthesized with porous structure. So this is the key property that we would like to use in the fabrication of electrochemical biosensing platform. So this one is the nanomaterials what we have synthesized, and when we are seeing its transparency, it shows some transparent properties also. So this is the synthesized nanomaterials. I would like to play this one. It is, yeah. So this video is recorded in our lab. So this is the copper substrate where we have synthesized hydrogen substrate graphene. So when you can see here, this is the 2D sheet like structure. Yeah. So these properties can help in the use this material in the terms of wearable biosensing fabrication of wearable biosensing devices also. So this is the 2D hydrogen substrate graphene nanomaterials. Yeah. So this one. Yeah. Okay, so when along with this one, we would like to investigate its zeta potential. What is the potential of the upper synthesized nanomaterials, its pore size, and its surface area? So we have investigated its zeta potential is about 12.06 minus 12.06 millivolt with pore size 7.8 nanometer, and surface area is about 26 meters per gram. So this is the surface charge electronic property of the synthesized nanomaterials. Along with this one, uh, after the synthesis of this material and electrophoretically deposited on indium phenoxide coated glass electrode, we have done its we have done its FTIR studies before immobilization of antibody and after immobilization of this anti-antigen A2 biomarkers. So we got some specific peaks at 10 1076 and this in between 3300 to 3330 to 3300, and along with this one we also investigate through a scanning electron microscopy. So morphologically, we can see there is some changes in morphology. Some globular structure is have been observed. So it indicates successful immobilization of our in a bioreceptor, that is anti-annexin A2 onto the hydrogen substrated I2 electrode. Along with this one, mm, along with this one, we have done electrochemical characterization. Several techniques is used, but here we have discussed only two techniques. First one is cyclic voltammetry and differential pulse voltammetry. So initially we have done electrode characterization, and for different step wise we have done it through. So first one is ITO, second one is hydrogen substrate graphene, third one is immobilization of bioreceptor on this hydrogen substrate graphene ITO electrode, and last one to prevent some specific site. Okay, so we use BSA molecules, non-specific binding site. We use BSA molecules to prevent false current. So we can see here anodic peak current ITO is about 463 microampere. When we have immobilized some 2D nanomaterials like hydrogen substrate graphene, its current increases up to 529 microampere. When antibody and BSA is immobilized, then definitely due to its insulating behavior of bioreceptor, its current decreased to 518 microampere and 514 microampere. So this one is the electrode study. After this one, we would like to investigate its electrokinetics with the help of a standard study. So we have done it in between 10 millivolt per second to 200 millivolt per second. So we get a straight line. Both anodic and cathodic peak current indicates this this electrode can be used for the development of electrochemical biosensing platform. Well, after this basic characterization of fabricated electrode, we further move for the electrochemical response study, that is mainly called biosensing study. We have done by two different techniques. First one is cyclic voltammetry and another one is differential pulse voltammetry. So through this both techniques, electrochemical techniques, indicates linear detection range is in between 0.01 femtogram per ml to 1000 nanogram per ml. With both shows limit of detection is about 0.01 femtogram per ml. With sensitivity, when we are talking in terms of cyclic voltammetry, it is about 13.8 microampere log nanogram per ml inverse overall centimeter square. But when we are talking about the DPP, its sensitivity is decreased, that is about 2.8 micron. So this is the basic difference, but both shows linear detection range from 0.1 femtogram per ml to 1000 nanogram per ml to detect annexin A2 biomarker. So, on the basis of this obtained result, we would like to investigate its in terms of molecules. How many molecules our developed biosensing platform can we investigate this annexin A2 biomarker. So, on the basis of reported calculation, we have seen here this developed biosensing electrode having ability to diagnose up to 3 molecules of annexin A2. So, we can see it is ultra low level. So along with this one, we have also investigate control study, interferent studies, reproducibility, and self-life. So on the basis of these all done through both techniques, cyclic voltammetry and differential pulse voltammetry. Here we have represented our results obtained through the cyclic voltammetry, and on the basis of control study, we can see there is negligible change in percentage RSD change in the peak current. So it indicates our electrode that shows Electrochemical response against antigen A2. This is due to binding of antigen with the antigen with the our bioreceptor molecule. Along with this one, interferent molecules, some interferent molecules is present in our biological fluid in terms of serum, just like cardiac troponin, other biomarker, cardiac troponin, CFR21, SAA, urea, several interferent is present in our analyte. So we would like to investigate its response in our peak current. So we can see here under the percentage RSD, that is about 10%. So it is under the 10% RSD value. So on the basis of this one, we can say our developed biosensor can be used for the diagnosis of liver cancer biomarkers. Along with this one, we have also seen its reproducibility study and shelf life, and its shelf life is about 35 days. So on the basis of this one, we now move for the real sample. That means sample obtained through the liver cancer patient. And we have obtained this sample from ILBS Delhi. So here we have only taken 4 samples, and we have investigated its concentration with the help of ELISA technique, gold standard technique, that is used for the protein diagnosis, protein concentration diagnosis, and we compare it with our fabricated electrode surfaces, electrode surfaces. That indicates our average percentage value is about 5.43. That is below the acceptance level. So this fabricated electrode can be used further for the development of point of care devices on the basis of this obtained result. So conclusion of this first work is we have successfully synthesized 2D few layered transparent semiconductor hydrogen substrate graphene, and it is used for the liver cancer biomarker detection. Linear detection range that we have observed is 0.01 femtogram to 1000 nanogram per ml with sensitivity through CV 13.8 and DPV 2.8. Definitely CV is more better here with respect to DPV. And this platform having ability to diagnose up to 3 molecules of anexin. But limitation is the lack of functional group. Due to this lack of functional group, there is no formation of covalent bond between antibody and nanomaterial, due to which we have obtained less or lower shelf life. So to remove this one, we would like to introduce some specific silane molecules that can able to bind this bioreceptor to the our to the our nanomaterial. So this first work is published in Biosensor Bioelectronics. Yeah. So another work is the amine functionalized to improve its shelf life. Our fabricated level, we have done next work, that is amine functionalized hydrogen substrate graphene, and we have tried to develop some covalent bond between our nanomaterials and bioreceptors. So this is the introduction about the 3-amino-propyl triethoxysilane. So as we know, this is the silane molecules, and it is very adhesive in nature, due to which we can easily fabricate self-assembled monolayer of this 3-amino-propyl triethoxysilane on the nanomaterials, due to which we are using this specific silane molecules as a linker to develop covalent bond in between bioreceptor and nanomaterials. So several chemical process we have used to functionalize our hydrogen substrate graphene. So a specific measurement, we have taken 30 microgram of hydrogen substrate graphene, and with the help of chemical process, we have successfully functionalized it with the APTS molecule. And after this one, same process we have used, but with different. Here we can see in the previous one, they need higher potential, that is 50 volt. Here we need only 30 volt to immobilize or to get thin films of APTS functionalized hydrogen substrate graphene onto the ITO. So this is the morphology of our synthesized nanometer hydrogen substrate graphene. This is the transparent in nature, and this what we have did here, we have investigate its covalent bond form in between amine group present on APTS and yeah. So yeah, and C-OH group present on FC region of the anti-anexin A2 biomarker. So this is the CN bond formed and indicates we have successfully make covalent bond in between NH2 group of present onto the APTS molecules functionalized onto the our nanomaterials, and FC region of antibody where C double OH group is present. C double OH group is present. Yeah. So after this optimization, we have again done electrochemical, some basic electrochemical technique characterization like electrode study and scan data study, and we obtained good results. So this is the electrochemical response main results that is used for the that can be used for the development of quantum optical devices. So here with respect to CB, when we are using APTS, so CB we have not we have not obtained good results. So here DPB shows good results. So it may be in terms of what potential of which type of anodic and cathodic reaction occurs in between our fabricated electrode onto the fabricated electrode and the analytes present in the sample. So it will depends on that. So here and for this specific nanomaterials, when we are using APTS, DPB is far better with respect to CB and impedance spectrum. So here we have obtained linear detection range in between 10 to the power minus 4 to 100 nanogram per ml with sensitivity 0.96 microampere log nanogram per ml per centimeter square with limit of detection 10 to the power minus 4 nanogram per ml. Along with this one, we have done control interference and reproducible studies, and these study indicates it is under the acceptable percentage RSD value, that is less than 10%. So along with this one, we have investigated its self life, and we have also done real sample analysis, that is liver that is obtained from the ILBS liver cancer patient. So in terms of when covalent bond is not present here, when we have make covalent bond, its shelf life is increased, that is 63 days. When we are talking about glucometer, so when it sample is not open or your electrode is not open, so it will work up to 3 months. So when we achieve up to 90 days, so that is the standard. So when we would like to achieve the at least that shelf life, that is up to 90 days. So here we with respect to first work, we have achieved more shelf life, that is up to 63 days, and we have also compared it with first we have investigated its concentration of annexin A2 which is through ELISA technique, and after that we have compared it with our fabricated electrode, and here percentage RSD is obtained, average percentage RSD obtained is approximately 2% with when we are comparing a standard samples and real samples. The real sample, that means sample obtained, that is biological sample like serum sample that is obtained from the liver cancer patient. So this is the platform what we have developed. So conclusion of this work too is we have successfully covalently immobilized antibody onto the amine functionalized hydrogen substrate graphene platform with linear detection range 10 to the power minus 4 to 100 nanogram per ml. Sensitivity, definitely we lose sensitivity, but shelf life increase, that is 63 days. So this is the conclusion what we have achieved, but limitation of this work is low sensitivity, that is about 0.96. It is lesser with respect to previous one, and this may be due to addition of some specific insulating layer in just like APTS molecules. So this paper is published in ACS Applied Biomaterials. So now to overcome this limitation, we have moved for the third work, that is hydrogen substrate graphene. Intrinsically, we have we have developed some C double OH group, CHO group, or OH group, some functional group we have intrinsically developed. So here we have synthesized hydrogen substrate graphene oxide. In the first work, we have used first and second work, we have used hydrogen substrate graphene. So this is as per knowledge, this is the first report towards the use or synthesis of hydrogen substrate graphene oxide. And here now we would like to move towards the point of care devices. So now we have used a screen printed electrode. So this one is the screen printed electrode, and we have modified it with the help of hydrogen substrate graphene oxide, and after that we have covalently immobilized antibody, and after that BSA to block non-specific binding site. So this type of functional group we are predicting to appear on the hydrogen sulfide peptide, just like CHO group. So this type of group may appear. So similar chemical process is used for the synthesis of this one, and through XRD we have primarily investigate, we have successfully synthesized hydrogen sulfate graphene oxide. We have also done its XPS study, and functional group and some functional group or some oxygen molecules is present into this synthesized nanomaterials. That indicates we have successfully synthesized hydrogen sulfate graphene oxide. When you can see here in the figure C single bond O, C double bond O, C double bond O, C single bond O. Here you can also observe O double bond C, single bond O, C single bond O, and C double bond O. So on the basis of this XPS study, we can see we have intrinsically developed some functional group in the synthesized nanomaterial. So this is what we have observed, its morphology of the synthesized nanomaterial. It is tiny with respect to hydrogen substrate graphene, and its area, yeah, or its size note is not more than about 100 nanometers with very thin layers. We have also investigated its FTIR study. We have also investigated its functional group. So you can see some a specific peak is observed at different places. Here 1103, 1625. That indicates, that confirms the results obtained through the XPS. So after this one, we have done this one. It's done its pore size analysis and surface area analysis. So we can obtain 12.3 nanometer, and we have also investigate its stability in or dispersibility nature in with respect to hydrogen sulfide graphene. So after 24 hours, you can see here. So this one image J indicates it some settlement of our synthesized nanomaterial plus. But when we are talking about the hydrogen sulfide graphene oxide, it is well dispersed in nature. So on the basis of this one, we can easily say our synthesized material shows non-agglomerative properties, and it can be dissolved for more prolonged time. So along with this one, again we move for the development of point of care devices. So some electrochemical characterization is needed for this one. So a basic electrochemical technique, just like electrode studies have done, and we have also done various electrochemical things, just like pH studies, scan data study we have done, and data notes on here you can see in our research paper. Okay, so it is available. Yeah, so after this one, after basic electrochemical studies, we have done main electrochemical response study. So you can see here we have obtained larger or more linear detection range with respect to the previous one, that is in between 10 to the power minus 8 to 10 to the power 5 nanogram per ml, with limit of detection 10 to the power minus 8 nanogram per ml. With sensitivity, it is higher with respect to the previous one, that is 0.98. Here it is 8.6 microampere, microampere log nanogram per ml per inverse per centimeter. So after this one, control study, reproducibility study, shelf life, we have done these all things, and here we got shelf life up to 84 days. So it indicates we are moving in right direction towards the development of point of care devices. So now in project one, we would like to compare these all developed biosensors. So first one, hydrogen substrate graphene, with the help of DPB, we got linear detection rate in between 10 to the power minus 8 to 10 to the power 3 nanogram per ml. Lower detection limit of detection is 10 to the power minus 8 nanogram per ml. Sensitivity 2.8 microgram when we are talking in terms of DPB. Response time is about 20 minutes. Shelf life is about 35 days, and this is about the first work. Second work, yeah, definitely we increase shelf life when we are when we are covalent bond. We have fabricated covalent bond in between bioreceptors and APTS molecules of the available onto the hydrogen substrate graphene. But when intrinsically when we are developing some functional group in hydrogen substrate grade dyne, then definitely its shelf life is increased, and we also increase its sensitivity, that is 8.7, which is far better with respect to the 1 and 2. So on the basis of this one, we can say we have developed highly efficient hydrogen substrate graphene oxide based biosensing platform for liver cancer biomarker diagnosis. It is hydrophilic nature due to several functional groups in terms of CHO, COOH, OH. So this type of functional group is present. So we can say it is hydrophilic in nature. There is no requirement of any linker molecules for covalent immobilization of bioreceptor, and it is the developed sensor having wider linear detection range, that is 10 power minus 8 to 10 power 5 nanogram per ml, and very good sensitivity 8.6 microampere, low limit of detection, that is 10 to the power minus 8 nanogram per ml, that is approximately 3 molecules of annexin A2 with shelf life of about 84 days. So here our we have successfully developed our chip. Now in the last we will discuss about the we are working on the development of electronic devices also. So this is about the project work. So now we will discuss another work in terms of lung cancer diagnosis, that is nanomaterial based biosensor for lung cancer detection. So that is the first part where we have investigate hydrogen substrate graphene oxide. So we are in process to we are in the process to patent the last work towards the development of point of care devices for liver cancer diagnosis. So another work that is nanomaterial based biosensor for lung cancer diagnosis. So as we are aware that lung cancer, it is one of the main death causing cancer, and several diagnostic techniques is available, but all these techniques available are not cannot work as a point of care. So there is several conventional techniques just like biopsy, CT scan, MRI scan, PT scan, sputum cytology. Several techniques is available that can be used for the diagnosis of lung cancer, but not work as a point of care devices. Limitation: visualization of large size tumors. These techniques depend on the expertise, expensive, at least when we are talking about the biopsy, at least 10,000 rupees is needed, and results give at least after 72 hours. So we can say there is some limitation of these conventional techniques. So again we are we have investigated several papers, and here we have shortlisted 4 different biomarkers, and this one CKAP4 biomarkers when we are talking about the AUC, sensitivity, specificity, PPV, NPV. So in terms of this one, we can say CKAP4 can be used for the diagnosis of lung cancer. Its cutoff value is 250 picogram per ml, and below this one subject is healthy, and beyond 250 picogram per ml subject is suffering from the cancer. So there is the basic of the CKP4 63 kilodalton A and 602 amino acid it is made up of. And so when we are talking about the work done first, so here we have used some chalcogenides, metal chalcogenides, just like molybdenum sulfide, that is generally used for the various application in terms of biosensor, and also in terms of capacitor, supercapacitor, or memory cell development. So so on the basis of this one, we have selected some chalcogenides molecules. So nanodot zirconium trisulfide modified ITO based biosensor for lung cancer detection. So here there are several properties to enable band gap, superior conductivity, high electron mobility, faster charge transfer kinetics, make this zirconium trisulfide as a good immobilization matrix for the development of electrochemical biosensor. Here we have compared in terms of zirconium oxide, metal oxide, and zirconium trisulfide in terms of metal chalcogenide. So here, when in terms of conductivity, when we are discussing, when we are talking, so it is about 10 to the power 6 order far better with respect to zirconium oxide. Dielectric constant is 22 with electron mobility about 25.98. It is also again 10 to the power 4 orders more better with respect to zirconium oxide, and band gap is in between 2.02 plus minus 0.02. So we have synthesized this metal chalcogenide, that is zirconium trisulfide, with the help of hydrothermal technique. And after this one, synthesis of this one, we have investigated its morphological and electrochemical properties, and we have fabricated our point of care electrode. So when we are talking about nanomaterial size, it is about 5.7 nanometers. So we can say we have synthesized nanodots below 10 nanometer. Nanometers we can call as a nanodots when percent property is not available. When percent property is available, then we can call it the quantum dot. So it is this material doesn't have properties like percent. So it is. So we can say it is nanodots. So we have successfully synthesized nanodots and characterized it with the help of XRD, transmission electron microscopy, and we have seen its distribution, particle size distribution. So on the basis of this one, we can say we have successfully synthesized nanodot of zirconium trisulfide having size approximately 5.7 nanometer. So along with this one, we have investigated our fabricated electrode through FTIR, and peaks obtained, different peaks obtained. We have, yeah. So a specific amide bond we have observed at 1093 per centimeter, that indicates successfully covalent immobilization of a bioreceptor onto the synthesized nanomaterial. So this is the another electrochemical characterization, that is a scan data study. This one is the after development of point of care electrode, and this one is when we have not immobilized the anti KP CKP formula. So what results we have obtained here, we have obtained along with this one, we have also done some another electrochemical characterization techniques, just like electrode study, ITO, APTS, functionalized zirconium trisulfide, anti CKP4 APTS, ITO electrode. So this type of electrode we have indicate, this type of results indicate we have successfully fabricated biosensing electrode. So after this one, we have done some electrochemical characterization technique we have used. Through we have done cyclic voltammetry, chronoamperometry, and impedance spectroscopy with DPB. So when we have compared different techniques, DPB here, DPB shows bit more good result with respect to other technique. So here what we have obtained on when we through our developed electrode. So our developed electrode shows sensitivity, that is 68.76 microampere log picogram per ml per centimeter per inverse per centimeter square, with linear detection range is in between 100 to 800 picogram per ml, with LOD 84 picogram per ml. So we have also done several control, we have also done control study in between the range what we have obtained through the electrochemical response studies. So result A shows acceptable percentage RSD value. This one shows interferent study. So when we are talking about the biomolecules present in liver, in the serum sample of lung cancer patient, there is several other biomolecules is also available. So we have investigated interferent, mainly what we observed in the lung cancer serum sample. So on the basis of this one, we can say we have obtained acceptable percentage RSD value, and here shelf life is about 36 days. So this is the limitation definitely, but we have done we have investigated onto the real sample. We have obtained through some another hospitals. So here we can see percentage RSD is in acceptable condition. So our developed sensor can be used for the diagnosis of CKF4 biomarkers. So this one is the comparative analysis of our developed device and developed electrochemical biosensing devices or electrode, in terms of what generally we have used, just like sputum cytology, CT scan, biopsy, and biosensor that is developed for the lung cancer, that is used for ethylene acetate, VEGF165, CEA, HER3. So several biomarkers is used. So we have compared it with the present work. So we got wider linear detection range with good sensitivity. So conclusion of this work done first project 2 is linear detection is obtained in between 10 to 800 picogram per ml with a limit of detection 84 picogram per ml and sensitivity of about 68.76 microampere log per picogram per ml inverse per centimeter square. But there is some limitation of this work: low sensitivity, rigid substrate, complex disposability. So these are the main limitation of this work, and this work is published in microchemical journals. Yeah. So another work in project 2, that is zirconium trisulfide with reduced graphene oxide modified conducting thread-based biosensor for lung cancer detection. Here we have used thread as a substrate instead of ITO, traditional electrode. So first we have synthesized nanostructured zirconium trisulfide with reduced graphene oxide, and after that this nanomaterials we have obtained or synthesized through hydrothermal process, and we have fabricated conducting cotton electrode with deep coating process. So this is the process here as a ink, conducting ink. Here we have used P dot PSS, and as a immobilization matrix we have used nanostructured zirconium trisulfide and reduced graphene oxide. Optimized concentration of this one we have used for the fabrication of conducting thread electrode. So this is the schematic diagram what we have done, or what we have done in terms of fabrication of thread based electrode for biosensor development. So when just like previous one, we have investigated some, or we have done some basic characteristics, just like XRD, scanning electron microscopy, transmission electron microscopy. So we have investigated it, and this obtained XRD graph is well matched with PCPDF, and this same image indicates presence of some nanoparticles onto the reduced graphene oxide. So to investigate in good condition, we have done a transmission electron microscopy. So this one indicates some nanomaterials is present onto the 2D nanomaterials, that is zirconium trisulfide onto the reduced graphene oxide. So this is the fringe width that is available of the nanostructure zirconium trisulfide. So after this one, we have also done a scanning electron microscopy, a study of our cotton thread, what we have taken initially. Okay, and another one is P dot basis modified thread that is conducting in nature, due to which our electrode gets conducting, and this C1 is the outer optimized concentration of zirconium trisulfide reduced graphene oxide into the P dot basis onto the thread electrode, and this one after immobilization of bioreceptor, that is anti-CKP4. So there is some changes observed in terms of morphology. We would like to keep same magnification or same scale bar for these studies. So along with this one, we have also done a FTIR study. So this black graph is the FTIR results of the P dot PSS of conducting thread. Second one, this green one is the nanomaterials modified thread, and this blue one is after immobilization with the bioreceptors. So on the basis of peak obtained, we can see we have successfully synthesized or fabricate our biosensing electrode that is based on thread. So this is the results what we have obtained through electrochemical technique. So in this one, what we have obtained, some drawback of the drawback we have obtained, that is for this one, when we are talking about the thread base. So there is the here DPB and CB and impedance will not work. So here only chronoamperometry technique can work. So we have done. So here we have not obtained results when we are using cyclic voltammetry, differential pulse voltammetry, and impedance spectroscopy. But when we have done it through chronoamperometry, definitely we got some good results, and we got its optimized peak current, optimized current within 120 seconds. So on the basis of this one, we can see we can develop this. Yeah, we can use our developed electrode for the detection of CK for biomarker for point as a point of care devices. So after this basic characteristics of this one, now we have moved for the main electrochemical impedance electrochemical study, that is electrochemical, that is biosensing study, and we have obtained very good result in terms of sensitivity 85.2 microampere, linear detection days is in between 6.25 to 800 picogram per ml, with lower detection of limit, that is 6.25 picogram per ml. So on the basis of this one, we can see we got good results in terms of biosensing parameter. When we are talking about in terms of control studies and interference studies, real sample studies, self life, so here first we have done control study. So it is in so control study interferences all are in acceptable percentage RST. So what we have obtained, its shelf life is about 40 days only. So we need to move or improve its shelf life with several modification or by using several another nanomaterials. But this is the first report what we have done in terms of thread-based biosensor. So this one and our fabricated electrode is also investigate the biomarker present in serum sample of lung cancer patient. Here we have used five different patient sample of lung cancer, and we got good results in terms of RST. So now we have compared project two with two different work. First one is zirconium trisulfide or metal chalcogenides, and in terms of chalcogenides, when we have used with some other nanomaterial, that is reduced graphene oxide. So when we have compared linear detection days, first we got from 100 to 800 picogram per ml, but when some 2D nanomaterials is used, we got wider linear detection rate, that is 6.25 to 800 picogram per ml. With lower detection limit, definitely it shows better with respect to previous one. Previous one is 84 nano picogram per ml. This one shows 6.25 picogram per ml. Sensitivity also increased. So, and first one is ITO, traditional electrode. Here we have used thread electrode. So shelf life is also increased 42 days, but it is not at a commercialized level. So we are working on this one to develop thread, and we would like to develop some just like kalwa. So you can wear in your wrist, and you can see its concentration in your watch or some electrochemical devices. I will discuss it later. So conclusion of this work is we have developed some ZRS2, ZRS3, the RGO based biosensing electrode for CK4 biomarker diagnosis. This developed electrode shows wider linear detection range, is in between 6.25 picogram per ml to 800 picogram per ml. Good sensitivity. Linear detection limit is also good, 6.25 picogram, because when we are talking in terms of CKP4, its concentration or cutoff value is about 250 picogram per ml. So it is far below with respect to cutoff value. So we can also with the help, when we would like to investigate this one, it will be also helpful to investigate or predict the status of occurrence of lung cancer in normal subject. So self life this electrode is 42 days only. This work is published in bioelectrochemistry. So summary of this presentation is this presentation or this work is the we have fabricated ZRO2 or porous carbon hydrogen substrate graphene zirconium trisulfide modified biosensing electrode, and several the fabricated electrode, that is lastly what we have developed hydrogen substrate graphene oxide, and last one that is zirconium trisulfide and reduced graphene oxide. This can be used for development of point of care devices. So this one what we have done here. So yeah, so this one I'd like to play this one. Yeah. So able to so Yeah. So this type of devices we would like to develop, electronic devices. Yeah. So what we have done here, so this is the electrode what we have developed. You can see here. Yeah, this is the devices what we have developed, and this is the electronic component what we have developed in our lab. So when we have incorporated some, this is the analytes, standard analytes and standard samples what we have done. So here we have obtained results in ampere only. So we are working to convert this current in microampere. So our results, so our electrode or our device can be used for the development of the, yeah, we would like to replace this one, some electronic devices we would like to improve. So initially what we are doing here, so this type of devices we have developed, so it is compatible with the our mobile phone. So this one, and yeah, this is the working condition. So what we have developed here, so this is the electrode what we have fabricated. This is the point of care devices. This one we would like to replace because its cost is very high. It's about 1.25 lakhs. So we would like to replace this one with this electronic devices, not more than 500 or 1000 rupees. So this one just like glucometer, and you can get that one, or you can replace this one with and that is compatible with your electrode and also with your mobile phone. So so we would like to develop this one. So we are in the process to develop this one. Yeah. So this is the acknowledgement what we have done. This is our research group at Delhi University. These are my 4 PhD students, and they have already done their PhD. And these students are doing PhD currently at NIPER Ahmedabad. So thank you. So I'm thankful for these students. This is the master student and PhD currently working in my lab, and this is these students are working that is passed out in the last this year only. 31st May, they have done good work, and they all are placed some in different companies. So we acknowledge this one. So along with this one, I'm thankful. Our lab is well funded with DST, CRB, ANRF. Currently, we receive again received NRF funding. Ahmedabad, very good funding. They give us DOP, Department of Pharmaceuticals, and also along with this one, Delhi University also gave funding to investigate or to develop this type of devices. So this is the reference. So thank you for giving opportunity, organizer. Thank you to giving opportunity, President of Mody University, to give this big platform for to present my research work in more than 100 participants. Thank you. Yeah. So if you have any question, please ask. I'm happy to answer if I can. Yeah.
Thank you, sir. It was really inspiring session. Few participants have asked some questions.
Yeah.
They sent me in the WhatsApp. So he is Dr. Rameswar Sugandhi from Bhopal. He has some questions. What nanomaterials are most suitable for electrochemical biosensor devices in cancer diagnosis?
When we are talking about the standard, gold is showing very good results, but cost is very high. So we cannot replace gold with respect to another nanomaterials. We are working on this one, just like hydrogen sulfide we are buying. So this is unexplored material. So along with this one, we also would like to develop some. You can say in terms of battery development or semiconductor, but here we are exploring in terms of electrochemical, but we cannot replace till date gold nanoparticles. So as per my opinion, about more than 13 years experience, we can say gold is very good nanomaterial that can use for the development of point of care devices. So, yeah. So this is my opinion. That may be different. Scientist wise.
He has one more question. How do electrochemical biosensors detect cancer biomarkers, and what are their limitations?
Yeah. So as you can see in each subject, each conclusion part of each work, I have discussed some limitations, and what is important when we are talking about the biosensor? Very very standard and very acceptable principle is behind this electrochemical biosensor. When bioreceptor is bind with the some analytes Okay, so there is the formation of insulating layer because analytes, that is your biomarker, and bioreceptor, that's it may be in the form of antibody, it may be in the form of DNA, it may be in the form of mRNA, rRNA. So if any form of bioreceptor can be used. It will depends on what you would like to invest. So if here in all works we have discussed about the antibody. So antibody having phenomena to bind with the analytes. Okay, so FAB region having ability to bind a specific site of the antibody. So this is the well established method. So but when one molecule is immobilized, when more than 10 molecules immobilized, when more than 100 molecules immobilized, current definitely decreases or increases. It will depend on insulating layer it form or some conducting layer is formed. So if insulating layer, generally insulating layer is formed, so current will be decreases. So when one analytes will be immobilized, current will decrease lighter, very few in terms of a standard sample. When there is the formation of thick layer of insulating layer, then there is decrease in more decrease in the current or in current in terms of current. So on the basis of this phenomena, analytes can be easily diagnosed with the help of electrochemical biosensor. Limitation, definitely some what is the important thing, we have to investigate our full range of analyte that is secreted in biological samples. When we are talking about the glucose, it will be in the 60 milligram per deciliter to 1000 milligram per deciliter. Okay, beyond 60% will subject will be not survive. Beyond 1000 subject will be not survive. So definitely it will the developed sensor having should have or should cover whole physiological range of the analytes. Second one shows good sensitivity, that having ability to differentiate 120 milligram per deciliter to 121 milligram per deciliter, and also 190 milligram per deciliter. So if subject is suffering from this one diabetes, if someone is 190 nano milligram per deciliter, they do not worry, oh I'm okay. But this result will show 121, so sometimes they will got fair. So our that proposed sensor should having ability to differentiate this concentration value. That value only be possible if your electrode is more sensitive. So this is the basic parameter. If sensitivity is lower, we cannot say this is the diabetes. When we are talking about the cancer, someone is got some false result, or we can't say you have cancer. If a subject is normal, when they done biopsy or some other techniques and he got, then it will be very difficult. And what is the mindset in between these days? So sensitivity is very good, and your what you would like to investigate, it is very important. So these are the limiters, so we should work on these specific parameters. Yes.
Right, sir. He has one more question. He is asking, what role do nanoparticles play in enhancing the sensitivity of electrochemical biosensors
Yeah, very
for
good
cancer
question.
diagnosis?
Yeah, very good if you can see, so nanomaterials, two or three properties is very important. First one is porous nature, second one is conductivity, and third one is dielectric constant. Okay, so if current is very high, okay, so it can give some slight changes. One molecule is immobilized, one molecule is bind with the bioreceptor, it give drastical changes in the conductivity. Some 100 micrometer, 100 molecules is immobilized. So if conductivity is very low, okay, so it will be very difficult to differentiate its changes in peak current. But when its conductivity is very high, it will be good to see, investigate slight changes observed onto the our electrode. So as per my opinion, conductivity will be better, your electrode or your biased electrode will be better. Yeah, so this is, yeah.
Right, sir. There is one more question. Can electrochemical biosensor detect cancer in early stage? And if so, why? So how?
Definitely, why not? If we can do we can investigate diabetes, we can also investigate. It will depends on the selection of biomarkers. Okay, if it is secreted in earlier stage and you investigate with any technique, not even electrochemical, you will do ELISA, you will do some other techniques, some percent techniques you can use. So if biomarker selection of biomarkers is correct, you can investigate or you can predict its concentration. If you can predict, just like you can compare it with glucometer, if you can investigate its concentration, definitely you can investigate its or you can investigate it in earlier stage, or you can also predict the what is the status, what is the probability to occur this specific lung cancer, oral cancer, or any specific cancer. You can investigate when you have selected a specific biomarker that are secreted in a specific cancers.
Right, sir. So there's one more question. How does the size and shape of nanoparticles affect electrochemicals, biosensors, performance in cancer?
Definitely, very good question, sir. So, what is generally used? If you can just imagine with road, okay. So, if there is more dig or there is, so your car is slow, will go slow. Okay, same phenomena occurs in when we are talking about the electron. We just would like to compare it with not exact situation what occurs here. So, when electron is moving, if your surface is rough, okay, so one part is here, one part is here, so electron will move here just like this one. If it is equivalent, it is in same surfaces, so it will smoothly move from one part to another part. How it will occur? It will occur when you have used control size. If you use 10 nanometer, it will give electrophoretically deposited onto the surfaces, it will give a smooth surfaces. But sir, if some part is 10 nanometer, some was 100 nanometer, so this type of surfaces you can obtain. So one part is 100 nanometer, another was 10 nanometer, 300 nanometer, again 200 nanometer. So if your size, you can control size. If you can control size of the nanometer, electron transfer is smooth. If your transfer is smooth, you can obtain a reproducible result. If electron transfer from one place to another places is not smooth, you never get acceptance level of percentage, that is 10%. Your reproducibility will be influenced. So, if you would like to investigate or obtain reproducible result, your surface should be a smooth with a specific particle size, and that give a good path for the electron transfer from one part to another. Yes, sir.
Right, sir. There is one more question. Can electrochemicals biosensor differentiate between cancer types or stages during using nanomaterials?
Sir, again, it will depends on the analytes. What is the acceptable biomarker? That is CEA, carcinic embryonic antigen. Okay, so before when subject is suffering from or feeling some cancerous symptoms, they go to doctor, and doctors about more than 80% doctors suggest first you have to investigate CA concentration. So this is the specific biomarker for any type of cancer. So if subject is suffering from the cancer, so CA is the gold standard biomarker. Along with this one, we can say this CIFRA21 for oral cancer, CKP4, and this annexin A2 biomarker can be used for the diagnosis of a specific biomarker, liver cancer, lung cancer, or oral cancer. This type of you can easily. So this what I have talked here. So on the basis of literature, what we have done in terms of liver cancer, lung cancer, and oral cancers. So definitely it will all depends on the biomarkers. So liver cancer, annexin A2 is very good. Lung cancer, another CKP4 is very good. And when we are talking about the oral cancer, CIFRA21 is very good. So, yeah, this is my opinion. It will depend on the someone is yeah, what will they have investigated in his research or research. Yes, sir.
Thank you, sir. Dr. Rameswar, I hope your questions are answered and you will get whatever you want to know. Any other question, participants? If you have, please, you can ask directly, or you can write me in chat box also. I think there's no question, no further question. So, Manpreet ma'am, please.
Thank you, sir, for your enlightening session. Your discussion on nanomaterials and biosensing devices has provided valuable insights on how to advanced technologies can facilitate early cancer diagnosis and enhance healthcare solutions. It was indeed inspiring. Thank you once again, sir.
Thank you, madam. Thank you, sir. And thank you, President of Mody University, who gave me opportunity along with your amazing team. I'm here. Thank you.
Thank you, sir.
Thank you, sir. It was really a nice session, and hope some participants, and we also try to collaborate with you for further future work.
Definitely, definitely. You can reach out my email ID. So
Sure.
it is available on website. So, yeah.
Thank you very much, sir.
Okay. Thank you, sir. Thank you. Thank you, ma'am.
Thank you, sir. Now, participants are requested to complete the session feedback form posted in the chat box. Those who have filled the feedback form may leave the meeting. This FDP will resume tomorrow at 6 p.m. Thank you all.